Hello everybody. Hi, good evening. I hope you all are doing well. I am Nurse Neye, and I mentioned earlier that I'm going to be uploading a video about to educate us about our kidneys, educate us as well what kidney disease is all about and how to prevent us from having kidney diseases. Okay, and I hope you all are ready for this video. Yeah. So first off, I want to start by letting all of us know what kidney is all about. You already know that the kidneys are the two bean-shaped organs that is in your body, just at the back, the posterior part of the body. And this helps to excrete excess water and unwanted chemical waste that is not good for the body. Okay, so you get to excrete this product as urine. All right, and a situation whereby this kidney is not able to function well, is not able to excrete the necessary unwanted waste products, and is not functioning well, that is where kidney problem will come. Okay, now we have some functions of the kidney. Apart from excreting unwanted products, excreting toxins, it also helps to ensure that there is electrolytes balance. So when there is electrolyte imbalance, that's when someone will start having kidney problems. When there is excess unwanted waste product, that's when someone will start having kidney problems. So I'm going to be educating you now how you can prevent kidney problems from happening. Okay, so I'm going to start by I've explained what the kidney is all about and then what it does. So I'm going to tell us some signs of some signs that we may encounter or someone may encounter to say that this person is likely to have a kidney failure or kidney disease. Okay, so stay tuned and I'm going to tell us more about this. All right, thank you. Right, so to say that someone has kidney diseases, there are some symptoms that this person may likely possess, some signs and symptoms that may actually come up for this person to start having problems of the kidney. So the first one is the change. There is, most times people normally have a change in the frequency of the amount of urine that they excrete. Sometimes some persons may say that there's dysuria, they are unable to pass enough urine. I'll try as much as possible to use layman language so that everyone can understand me. So when there is reduction in urine production, and when there is a lot of incontinence, like the person frequency and incontinence, the person tend to urinate more often, especially at night, then I would advise that this person tries to visit the hospital for annual checkup. It could be that this person has started coming down with diabetics, or could be that this person has started coming down with any kidney problem. So when there is excess frequency in urination, when there is presence of blood, hematuria, when there's presence of blood in the urine, when someone urinates, the person sees. All right, so when there is presence of blood in the urine, there could be a likelihood that this person will be coming down with a kidney disease. And another thing is when there is changes in the color of urine. So because the kidney is what helps to excrete unwanted waste products as urine, the urine is most times what we use to determine if this patient has a kidney problem or not. Is one of the things we use to determine if this patient has a kidney problem or not. So like I said, frequency in urination, presence of blood in urine, and when there is kind of color change in the urine of the patient, of anybody, that could signify that this person may likely have some kidney problems. However, having some color changes in your urine doesn't necessarily mean that you have kidney problem. Could be that you are dehydrated, so you need to take a lot of water. So I'm still going to tell us how to prevent kidney problems, okay? But please, when you continuously have changes in your urine from dark red to yellow or anything, please, you have to see the doctor. Okay, so another thing is when there is edema. So a lot of persons, you see them having nowadays something we call edema. Edema is swelling of the body, not increase in size. There's a difference between someone having flesh, having fat, and there's a difference between edema. Edema is when there is a kind of water, right? I'm trying to use a language that everyone will understand. When there is water situated in a particular place that is not moving, that is what we call edema. Now, how you know someone is edematous is when you press the skin when you press the skin and you press the skin for like 5 seconds, you release it. So the skin is still pitted, right? It's not coming up in the it stays that way, and it's not coming up in about 2 to 3 seconds. It shows that this patient or this person may likely have edema. So when someone has edema on their legs, and this most times happens to pregnant women, but that's not what we're talking about. But you likely, most times pregnant women do come down with things like this, and that is why we always tell pregnant women with edema to always make sure that they see their gynecologist, because it could be a health condition or a health problem that might be causing that. But currently we're talking about kidney problems. So when you see someone just all of a sudden start having edema, pitted edema, please, the person should quickly reach out to see the doctor. Okay, now another thing is pain, back pain. Remember I said that the kidney is situated at the posterior part of the body, which is at the back. Please, when you start having back pain, frequent back pain, it could be a result of kidney stones, it could be a result of any kidney problem, it could be pyelonephritis or any kind of kidney problem. We have a lot of kidney problems anyway. But please, when you start having consistent back pains, especially at the posterior part of your body, just here, please, you need to see the doctor. It could detect that there is a problem with the kidney. Okay, now high blood pressure patients with, or anybody with high blood pressure, should please always have their annual checks done. Okay, so I advise, if you know anyone that has high blood pressure, please, the person should always visit or have their annual health checkups done, please. Okay, all right. So apart from that, you can have generally feeling unwell, loss of appetite, nausea, vomiting, shortness of breath, itching, you know, a lot of things. Basically this things that I've listed about what happens in the urine, color changes, frequency, and on back pains and all that. Apart from that, any other random general unwellness that you feel, please, you need to see the doctor, okay, so that we can rule out any issues of kidney problems. All right, now there could be a lot of treatments for kidney disease, but we're going to talk about that one. I'm going to be talking about the risk factors. What exactly can cause kidney problem? What are the risk factors, likelihood of things that can cause kidney problem? Now, someone that has high blood pressure, like I mentioned, should always, please, see the doctor. They should have their annual health checks done, please, frequently. Please. It's very important, because patients with high blood pressure can easily come down with kidney issues. Yeah, and this is going to be a discussion for another day, how kidney problems can be gotten from high blood pressure. I'm going to talk about this another day, okay? But please, if you any of your parents, your mother, your father, or anybody related to you, or normally has high blood pressure of above 160 over 100, or anything above that, should please always have their health checks done, and please ensure that these people take their routine medications, okay? And please, I hope they are also on meds, please. Then patients that have diabetes, there's a likelihood of them coming down with kidney problems. And then, like I mentioned earlier, you could have patients, someone can actually get it through a family history. It can be gotten through, from the family. And then age can also cause someone to develop a kidney problem. It could be obesity can also cause that. So it's important we always exercise. As I'm talking to you, I'm talking to myself. So it's important we always exercise, please, so we can prevent these problems from arising. And please, another thing is to avoid smoking. See, excess consumption of alcohol and smoking should stop. These are the things that commonly cause kidney problems. Excess intake of salted foods can also cause kidney problems. So please, let's reduce the amount of the salty meals we take, and also stop smoking. With smoking, it's not just the smoking doesn't just affect the kidneys, it affects the lungs, it affects a lot of things, a lot of organs in the body. Yeah, so please, we should quit smoking, reduce the intake of alcohol, and I'm definitely sure that the rate at which we do have kidney problems in our country will drastically reduce if all these steps will be taken. Right. So the next thing I'm going to be talking about is a test that can be done for patients to rule out kidney problems. Okay, now there's a lot of urine tests that can be done. So like I was saying, there's a lot of tests that can be done to a patient or for a patient to detect if this patient has kidney problems. We have what we call urinalysis. Now, urinalysis helps to detect if there is glucose, protein, nitrates, and glucoside, bilirubin present in the urine. Now, what I'm going to advise everyone is to please, I know the situation of the country is not really nice, but I trust God for his help. If you can bring out a little money, even if it's once in 6 months, or even if it's once in a year, please go for health checks. Now, you can enroll yourself in some of this health insurance. We have NHIS, we have some HMOs that run health insurance. I would recommend you to open a health insurance with Hygia HMO. Yeah, it's really nice, and I've worked with them and it's super amazing. You can have your annual health checks done yearly actually. You can have your annual health check done yearly. Your blood sugar will be checked, your urinalysis will be done, cervical screening will be done for you, and all those. If you're a female, if you're a male, prostate scan will be done for you as well. So please, I would advise, take out a little money, enroll yourself in these insurance companies, and go to a hospital that they manage, and make sure that your annual health checks is done yearly to rule out any kidney problems. Trust me, dialysis, the money for dialysis is not here. There are people that live on dialysis. It's not just about the mental trauma that they go through. The financial part of it is really crazy, and I would advise that we prevent these things from coming up instead of allowing them to come in and we start curing it. So running annual checks, health checks, checking your urine, blood tests being done to check for acidosis. Those are toxins. When there's excess acids in the body, it can cause kidney problems. So this blood test will be taken to check for acidosis, to check if you have enough blood in your body, anemia, if you're anemic or not, to check if there is excess potassium, that is if there's hyperkalemia, if there's hyponatremia, excess reduced sodium in the body or anything. So this blood test can be done to ensure that you have the normal electrolytes in body, if it's normal, or to check if there is excess urea, creatinine, or if there's any issue at all with the electrolyte, or if there's any issues at all with anything in the body. So please, these annual health checks should be done. X-rays can be done, ultrasounds can be done for you, MRI can be done, biopsy can be done, but then please try as much as possible to enroll yourself in these annual health checks. It's really, 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 really important. Sincerely, talking about is prevention of kidney diseases. I've actually mentioned some of them while I was talking about the causes of kidney diseases and the rest of it. The first of one of them is for you to please ensure that you eat good diet. Ensure that you maintain good diet and eat a lot of fruit and vegetables. Avoid the intake of excess salty meals. Please. So when you're cooking, ensure that you use minimal salt to make your meal. And please, let's just make sure that your salt is iodized. Okay, let it be treated as well. Drink a lot of water. Please, ensure that you drink water. Stay hydrated. Reduce the intake of alcohol. Alcohol is not good for your body. Excess intake of alcohol is not good. Please reduce the intake of alcohol, and then try as much as possible to quit smoking. It doesn't just destroy your kidneys, it destroys a lot of organs in your body. Okay, and then patients that have underlying health conditions like hypertension, diabetes should always go for their routine checks. It's really going to help them. Okay, and try as much as possible to reduce your stress level. I know that everybody's working to make ends meet, but please just try as much as possible to take enough rest, stay hydrated, eat properly, enjoy a good diet, exercise frequently, and then I'm sure that all these things, kidney problems will reduce. Okay, and it will not come to you. All right, so like I said, ensure you visit your doctor just in case of if you have any symptoms that the symptoms that I've mentioned. If you have any of these symptoms, please ensure that you visit your doctor talk to them about your problems. If you're having back pains or anything like that, please talk to them before these problems escalate. Okay, thank you so much for watching this video, and if you have any other question, please try as much as possible to comment below, and I'll be happy to answer your questions. Okay, and please, I'll be happy if you can share this video, because I've noticed that a lot of our youths are just coming down with kidney problems, and this is not what I want for us. Most of these people come down with kidney problems because of their excess smoking and drinking, and this has to stop, please. So if you can kindly share this video and like, comment, let someone else that is amazing to you, someone now that you care about, someone that you love, let a person watch this video and learn something from what we've shared. Okay, thank you so much, guys. I sincerely appreciate you for stopping by. I'll see you next time. Bye.